I've been working in antimicrobial stewardship as the director of our program for the last 10 years. And we think that we have a very active and robust program. I'm an infectious diseases physician, so I do actively take care of patients. So I can speak to a lot of the challenges that we face with antibiotic resistance problems at this point. And to maybe add a little credibility to with this audience is, one, I work very closely. We have a very active One Health program at our university, and I work closely with the College of Veterinary Medicine, collaborating on research with a number of individuals. We have an active antimicrobial resistance research group that involves people from the College of Medicine, the College of Veterinary Medicine. We're also working actively with the veterinary hospital to develop an inpatient antimicrobial stewardship program that's modeled after what we do in the human side. Probably more important, my father-in-law is a dairy farmer. And I spent one summer working on the dairy farm, taking care of the calves, so I have some hands-on experience with this field as well. But let me just mention, this is a statement that came from the CDC in 1999 that says if we don't address this problem of antimicrobial resistance, we're going to reach a point where drug choices are not going to be available. And I think I can say very clearly from our experience is that we're at that point. We have patients now who have drug-resistant pathogens that there's either one or no drugs available to treat them. And we see this on not a daily basis, but a fairly regular basis in our medical center. We have a number of patients who we have very limited choices, and as a consequence, we have to use very expensive drugs and drugs that tend to have higher toxicity and problems. And I think it's been gratifying to me, somebody who's been working in this field for the last several decades, that it's now become recognized that the problem with antimicrobial resistance is a huge problem, and it was alluded to with the White House, the National Action Plan, and the international activities with the WHO and the UN, and the CDC's Global Health Security programs. Those are things that have really brought international attention to this problem, and so I think it's very timely that you're having this conference. So the CDC a few years ago came out with this antibiotic-resistant threat pamphlet a couple of years ago and identified the urgent hazard level group of pathogens, which for us, the carbapenem-resistant Enterobacteriaceae is a huge problem. And we see it on a regular basis in the medical center. And then all of these serious hazard levels, particularly the multi-drug resistant Pseudomonas acinetobacter, the MRSA problems that we have, and so forth. These are problems, I've just mentioned these because these are real agents that we deal with on a regular basis that provide challenges for us to treat these serious infections. And so in terms of the leadership, I guess what I see is that antimicrobials present such unique challenges, and I think they've been alluded to. I can't speak very credibly from the animal side, but I think that they've certainly been, the topics have been discussed at length in this conference. But in the human side, there's a huge number of antibiotics that are prescribed annually, and up to probably 50% of any hospital look at the number of patients that are receiving antibiotics. And many of these are unnecessary or they're suboptimal. And that's the big challenge we have, is how to track and optimize and train physicians to use these antibiotics in a more appropriate fashion. And the one thing that I usually tell our house staff and our physicians is that antibiotics are unlike any other drug. They're societal drugs, and if I use an antibiotic in one patient today, it may influence the ability of that drug to effectively treat another patient tomorrow. And that's a point that we have to continue to bring home to clinicians. And so stewardship, there's a number of papers that have come out. I just got back last week from the infectious disease annual meetings, the ID Week conference, and I was amazed at how many antibiotic stewardship sessions there were. It's really become a very, very hot topic on the human side. But basically, I think as was mentioned by the previous two talks, that antibiotic stewardship is not only really limiting the inappropriate use of drugs, but really what I try to teach is that it's about optimizing our antibiotic use. And the biggest thing is the right selection of drug, and a big focus that we have right now is duration of therapy, because we know that too long, or for so long, the course of antibiotics have been probably much longer than they have needed to be. And so when it gets down to the leadership thing, issues, it was mentioned, and I'm not sure because I haven't been able to attend the whole conference, is how much has been discussed about the core elements. But this is the CDC document, which is the foundation for the Joint Commission standards. So it was mentioned about the CMS standards are going to come in play in a couple of years for hospitals. The final rule for antimicrobial stewardship in nursing homes is already official and done. And the Joint Commission, which credits the hospitals, their standards start in effect on January 1st of 2017, and they're built on these core elements. And it looks at, one is that the facility dedicates the necessary human, financial, and other resources to the program, that there's a single, usually physician leader, that's accountable to the medical center leadership or the hospital leadership for the program, that you have a pharmacist leader who understands the drug, has the drug expertise, and understands the interventions and things to help improve antibiotic use. And then you have a number of things in place. There's ongoing interventions to improve antibiotic use. There's monitoring of antibiotic prescribing, reporting back to physicians and other individuals, and then education of clinicians and also patients about concern with antimicrobial resistance. So I would say it was talked about some of the international things. We've been fortunate. Our university for several years has had a One Health Summer Institute in Ethiopia, where and just the last year plus, I've been involved over there with antimicrobial stewardship interventions. And some of these issues around tracking antimicrobial use are huge because there's not automated systems, and I think the same challenges occur in the veterinary side of things as how do you actually monitor and track antimicrobial use. And then we just recently had a One Health conference in China where we were engaging with some researchers from Chinese universities around antimicrobial resistance. So I think internationally there's a lot of movement to address this problem as well. And it's got to be addressed globally because the issues across the globe in this field are huge. So.